You hear the words clinical trial and images of medical guinea pigs come to mind. But one local doctor wants to change all of that. He's an internist, a hematologist, an oncologist, and a principal investigator for local clinical trials. Dr. Maen Hussein, also a member of the Florida Cancer Specialist team, he wants you to know the importance of becoming involved in clinical trials, right here, close to home.
In January of 2010 is when I started seeing Dr. Hussein. Well, initially I thought I was going to be dead within 6 weeks. And they were going to cut off my left hand. And they saved it, still got it. And I had no idea in the beginning how it was going to start and how it was going to evolve. I live 1.5 miles from here. And if I had to go to Orlando, I wouldn't be here today. I'd be dead. I wouldn't be able to get the treatment. And it's been nothing short of a miracle in my case.
He was on hospice, and he's young, and I thought like he maybe has a chance, and he's still alive. He's with stage 4 lung cancer for almost 5 years. This is a disease that people like average live maybe 18 months, 2 years if they're lucky. There are a lot of cancers that 15, 20 years ago were a death sentence that now people are living years with. People are living longer with cancer. It's also becoming like a chronic disease. And one of the reasons that this is happening is because of clinical trials. Why? How do they help? We have better drugs. We have better ways of diagnosing the cancer. We have better ways of finding it at early stages. Now they're working even on blood tests that we can diagnose cancer from just taking a blood test instead of biopsy. The benefits of being in a clinical trial, because this is a very important topic, because a lot of patients say, well, I don't want to be a guinea pig. They think that clinical trial being a guinea pig. And I tell them, no, you're not guinea pig because you can make your decision. You have a choice. Even during the clinical trial, they can decide and say, you know what, I want to be out. They can be out. But I can tell you, we have trials that even those big centers don't have. And those trials that do change the standard of care. I mean, it's with new drugs that are very promising, and you know, you don't have to drive 2 hours to Shands or 1 hour to Orlando to get it. You can have it here in a local office, and you can get the same care, if not even better, that you would get in an academic center, even if they have the same trial. One of the new drugs that just got approved in the market for lung cancer trial, it's an immunotherapy type, and we were part of the clinical trials that taught us about how this drug works, and now it's approved for lung cancer and melanoma. We were also part of another chemotherapy drug that initially was approved for breast cancer, but we participated in the pancreatic cancer and lung cancer trials, and now it's the standard of care for pancreatic cancer and lung cancer patients. So if it wasn't for clinical trials, we wouldn't have achieved that knowledge where we now are doing a better job in improving cancer care. The idea of just focusing on patient care and having accessibility to the best treatment that we can get. So if there is a drug that gets approved today, I can provide it to my patient within a week. And if there's a trial that is very promising, I can have access to it also at any time. If there is a new test, I can have access to that test. I mean, that's the world-class medicine, really. I
try to hug him when I can, and he hates that. He's like, hey, I'm going, you're my buddy, man.
If you're interested in learning more about current research projects and clinical trials being conducted locally, visit flcancer.com and click the Clinical Trials tab.